An arthroscopic rotator cuff repair is usually performed awake under regional anesthesia, but sometimes we may do this under general anesthetic. If we're doing it awake, the arm will be numbed by the anaesthetist, the shoulder will be prepped, and then we put a camera into the back of the shoulder joint. We have a look around inside the shoulder and confirm that the rotator cuff is damaged, and also confirm any other damage within the joint that may need treatment. Depending on the size of the tear, the shape of the tear, and the tendons involved, we'll then attempt to repair the tear by passing sutures through the tendon and pulling the tendon back to the bone and anchoring them into the bone with plastic anchors that are buried into the bone and ideally stay in for life. We clear the space above the tendon and under the acromion bone to allow space for the tendon to glide, and we sometimes shave the undersurface of the acromion bone to remove any spurs. Small dressings are applied and a sling is applied. The sling is used to protect the repair, and this can be worn for up to 6 weeks, depending on the size and location of your tear. You need to start using the hand, elbow, and wrist the day after surgery, and ideally should be booked in with a physiotherapist within a few days of your operation so they can start getting you moving according to your rehab protocol. Once the sling is removed, the physiotherapist will focus on regaining the range of motion in the joint and then building the strength in the joint. But to protect the repair, we recommend no heavy lifting or sporting activity for up to 6 months. After 6 months, a full level of activity can take place, and we expect that it takes about a year for the shoulder to get back to normal after a rotator cuff repair. The complications of a rotator cuff repair include bleeding, but this is very low risk in keyhole surgery, infection, which should be less than 1%, and nerve damage is very low because there's no major nerves where we're repairing the tendon at the top of the shoulder. There is a chance of persistence of symptoms because for your tendons to tear, the tendon itself is probably degenerate and may cause the odd ache and pain going forward. There's a risk of recurrence of symptoms. The shoulder may feel better for a period of time, but pain can recur for other reasons. There's a risk of failure of repair if the rehab protocol isn't followed or if you have an injury early on. This can sometimes cause the rotator cuff to re-tear. In some cases, the rotator cuff repair doesn't heal because of the quality of the tendon. But even in patients whose tendons don't heal back onto the bone, they experience high satisfaction rates with this surgery because of the other procedures that are carried out during the operation. There's also a risk of stiffness with any shoulder operation, so we do try to encourage early activity, but we have to balance this with protecting the repair. And so there will be some element of stiffness after rotator cuff repair, but that's why the first focus of the physiotherapist is to regain range of motion. There may be other risks that are specific to you, and we'll discuss this in clinic prior to your surgery.